Hey guys, welcome back to the latest episode of the Growing a Dental Practice podcast. I am your host, Mike Kennan from Patient Boost. In today's episode, I'm joined by Deborah Hatanaka. Have I said that right?
Yes, you did. That's good. You're good.
Hatanaka. Sorry, I'm going to go back. Right, I'm going to start again. I don't normally do that, but I just wanted to make sure I get your name right. Hey guys, welcome back to the latest episode of the Growing a Dental Practice podcast. I am your host, Mike Kennan from Patient Boost. In today's episode, I'm joined by Deborah Hatanaka, founder of Eye for Wellness, a nutritional screening program that improves patient outcomes and boosts revenue for practices. Welcome to the show, Deborah. Thanks for joining me today. How are you?
Oh, I am fine. And thanks for inviting me. It's a beautiful day here in Toronto, nice and sunny, so I can't complain. How about yourself?
Yeah, similar. Obviously not in Toronto,
Right.
but it's a lovely day. I've been for a run today. It was very hot, maybe too hot for a run. But no, it's very good. So you have something that you want to mention before we step into the full show?
Yeah, just because we're going to be talking about health, I just want to say a little disclaimer. So these statements have not been evaluated by the FDA. This program or products are not intended to diagnose, cure, treat, or mitigate disease. There, we're done.
Brilliant. Perfect. Thanks, Deb. That's nice. For a disclaimer, that's nice and to the point.
Right.
Yeah.
Have to be careful.
Right. So yeah, exactly. You can never be too careful these days. So before we go into, what is Eye for Wellness and how it helps patients, and obviously more importantly, how it helps practices, tell us a bit about you. What's your background?
Okay, well, I guess I can go back to high school. When I left high school, my mom gave me the sage advice to not go to any higher learning education, to go straight into an office and start saving for my retirement savings plan and my saving for a house, set myself up for life. And that lasted about 1.5 years. And then I got smart. And I realized what I didn't want in my life. So I went on to fashion design, which has nothing to do with what I'm doing today. And
I was going to say that's a bit of a change.
I know. Yes, I have a bit of a creative brain. And then I went on to graphic design. And I subsequently started my own agency with my sister-in-law. And then I had my own for about 15 years. And at that time, I wasn't really looking for a change. I've always been interested in preventative health, life hacking, all that kind of good stuff. And my husband's also 14 years older than me. And at that time, I know we're going to be talking about nutritional testing. So my husband was tested and he didn't do so well. I did okay, but you get a score from 10,000 to 100,000. He was 27,000. So, which is not a great score. And so he changed nothing else, but went on some some pharmaceutical grade nutraceuticals. And he was able to come off high blood pressure medication. He had more mobility in his joints, just generally more energy. And I just delved into it further, and I could see that this could be a business, introducing it to doctors. And right now we have a sick management system. I think everybody can agree.
Yeah.
and I thought if I could be part of putting a little bit more health into healthcare, well, I'm all in. So I changed careers slowly, and now I'm doing this full time.
Fantastic. See, why don't I know about that? Why don't I know that about you? The fact that you had your own agency.
Yeah.
Oh man, we can swap some stories about
right.
that.
Yeah.
But no, that's so it was almost like some people start a business because they're already doing something, but it was more of a case of, personal circumstances, or you had a brush in with something, and that kind of led you down that path.
Mm-hmm. And everything leads to where you are today, right? So I find I'm doing a lot of design stuff for my doctors. I get to do personalized stuff for them, and they really appreciate it.
Perfect. Yeah, exactly. Just adding more value. So not only can you bring more money in, and we'll talk about that in a second, but you can help them with some other stuff as well. And does that, because I guess when you switched career, you still enjoy graphic design and design.
Yeah. No, I absolutely do. Yeah. Yeah. I was just doing a lot of.
Yeah, I was going to say I'm going to have to introduce you to our designer.
Okay.
I'm sure he'd love to. Anyway, we digress. But so again, what kind of drove the two of you, so you and your husband, what drove you to take the test in the first place? Was it recommended, or?
Oh, it was just a biochemist in Toronto. I was at some health event and I got a scan and he explained it very well, like really well as a biochemist. I just thought it was such an interesting thing that you can get that immediate result of what your diet and
Mhm,
lifestyle, how it's working for you in 30 seconds, totally
mhm.
non-invasive. So,
Perfect. Perfect. And that leads us on nicely to, yeah, so what is exactly is Eye for Wellness? Like, so just give us a bit more of a,
okay.
the details around the test and sort of how that impacts the patient.
Okay, well, I am a consultant coach and I'm a rep for the nutritional testing program. So the name of the company is a play on words, having an eye for wellness. So we provide a totally turnkey program for the practice. Everything's been done for them, including like patient letters to introduce it, brochures for follow up with the patients. Like everything has been handled and done for them. It's a small tool the size of a Kleenex box. It's inexpensive. And as I said, 30 seconds and it's totally non-invasive. So it provides the patient and the practitioner a reliable measurement of the patient's nutritional status, which obviously affects periodontal disease, which we'll get into
Yeah,
later.
perfect. Yeah. Yeah, perfect. That's a good touch on. But how does like someone's nutrition or what they eat and how they are like that in that respect? How does that affect their sort of oral health?
Well, it's been said that the mouth is the gateway to your overall health. So if you think of it that way, what we're eating every day, are we moving towards health or away from health? And we're all living fast-paced lives. None of us are perfect, right?
Mhm.
So the food supplies the nutrients and antioxidants to the body, the bones, the teeth, the gums to renew tissue, and then that helps fight infection and disease, inflammation, which affects periodontal disease. So ideally, we want to eat diet rich in antioxidants, so green leafy vegetables, dark chocolates in there, which some people might be excited about, berries, nuts, beef,
Absolutely.
yeah, all these things. So there are some good things in there.
Yeah.
But and an
Yeah.
interesting fact is a lot of people wonder, well, is organic better? Well, actually, it is because the fruit or vegetable itself has to create more antioxidants to protect itself because it's not being sprayed by pesticides. So you
Mhm.
you you get the benefit of that when you eat that.
Yeah. Of course, yeah. And I was gonna say, like, I'm definitely guilty of sort of choosing sort of convenience
Hmm.
over healthy choices. Like if it's like, and we all know fast food isn't good for you.
Hmm.
Sort of heavily processed food isn't great for you. But yeah, there is that. I personally need to get out of that habit of, reaching for what's easy versus, take a bit of time to prepare something or just go to the shops a bit more regularly to get the right things.
Yeah, no, absolutely. And a good way, excuse me, um, to get more in is just have smoothies. You can put a lot of fruits and veggies in that, spinach, berries, all kinds of stuff. I always tell people that, especially if they're not eating enough a day. Sorry, I'm losing my voice here. But if we're going to talk about antioxidants, because that's specifically what we're measuring, I also want to talk about free radicals because they're
Mhm.
created naturally in your body. But then also, the more if we process food, like you were talking about, toxins, pollution, even excessive sunlight can cause free radical damage in the body. And stress. I mean, stress is something everybody has. That's the number one thing. Smoking, pharmaceutical drugs, poor sleep, all these things affect free radicals in your body and how many you have. So our
Mhm.
cells are basically hit with about 10,000 hits a day with free radicals, believe it or not,
Yeah.
and that will
Interesting. Yeah.
accelerate aging, and it makes you more open to disease.
Oh, perfect. So we do want to try and avoid that because no one wants to
Yeah.
age faster than they
No,
have to.
no, I know. And then if you want a visual example, think of if you cut an apple in half and open it and leave it, and the oxygen hits it, it turns brown. But if you were to put lemon juice on one half, that's antioxidant protection. So that's what we're trying to do
Yeah.
for our bodies.
So that's why we do it.
Hmm.
That's why. Okay, that makes more sense now.
Yeah.
I've always wondered why you put citric,
Hmm.
liquid on fruit to kind of reduce the stainless, and that's exactly what it is,
Hmm.
preventing the free radicals. And fair enough. That sounds good. You learn
That's
something new every
oxidation.
day.
Yeah. Yeah. And that's the same, even when you think of avocados too, they turn brown, right? So you put,
Mm.
yeah.
They go brown very quickly.
Yes, they do. Yeah. So
Perfect. No, but they taste great though.
yeah, oh, they do. So I just want to explain Can I have a minute just to explain what free radical damage is, just so people understand?
Yes,
Like
please.
very,
Please do
very
that. Yeah.
quickly. So a free radical is a molecule with only one electron. So the antioxidants have a lot more electrons. So they donate one to the free radical and actually neutralizes it. So that's why you want an abundance of antioxidants. It's like your own little army inside your body looking after yourself, and it's a normal process. Like we're supposed to have free radicals but you want to manage the amount you have and limit because an overabundance of free radicals leads to oxidative stress, which leads to inflammation, which leads to disease.
Okay. So like anything, we need to find the right balance.
Yes, absolutely.
Yeah. And it's kind of, I guess, the right balance for the individual, I guess, based on size and age and everything like that.
Yeah. And it's very surprising when you scan people, because you think someone who's really thin and healthy, or someone who is like a bodybuilder, because they look the picture of health, right? I can't tell you the number of times I've scanned bodybuilders and they get a terrible score because they're big on protein and not much on antioxidants. And it just
So just because you might look healthy doesn't mean you actually are.
Yeah.
So I guess that's always why, obviously kind of digressing a little bit, but when people are surprised that they have serious illness, but they're really fit and stuff, but obviously illness doesn't take into account that you might be physically fit and everything.
Right.
So it's a good point. You obviously we've touched on periodontal disease, and you've mentioned in the past that there are sort of studies to show this. I know you've worked with doctors in the past that have kind of done their own studies. Tell us a bit more about that.
Okay, so there's an interesting website, and it's called PubMed, so PUBMED.gov, and you can plug in any disease. So last week I plugged in periodontal disease, and then you put a space and antioxidants. There's 1,600 studies. So that's pretty impressive. And then I decided to put periodontal disease and cardiovascular disease, 1,800 studies. So there's definitely that systemic relation between periodontal disease and heart disease. So basically, the bacteria from infected gums enters the bloodstream and can cause the arteries to build up with plaque, and then that can put you at risk for a heart attack. And 75% of the US population dies from cancer and heart disease alone. And I'm sure it's similar all over the world, but frightening and true.
So you mentioned that. Yeah, it's probably similar in most, especially maybe most developed countries, probably the same. But no, that makes a lot of sense now. I think before I personally couldn't really picture it, but it makes a lot of sense. Like if our teeth or our mouths are producing extra, let's say plaque, like extra material,
right?
That's got to go somewhere,
right?
And that's just like fat, I guess. If we eat fat, it stores up in the body, and I guess just has those negative consequences.
No, absolutely. And there was this one study that in the abstract, I just want to read it to you because I thought it was pretty interesting. It says, many studies have observed that the balanced diet has an essential role in maintaining periodontal health. Additionally, the influence of nutritional supplements and dietary components have been known to affect healing after periodontal surgery too. So not only like if you're healthier, you heal faster and also heal better, like in terms of scarring and stuff like that.
So if this has a lot of positive impacts, what is maybe happening from a wider society's perspective that kind of stops people sort of taking advantage of that or doing making the most of that?
You mean getting scanned in general? Do you mean, is that what you're saying?
Yeah, I guess like if we know that if the studies are out there that say that we should if we improve our periodontal health and it improves the whole body, like why aren't we all aware of that?
Well, I think it's education, really, right? Because while you're getting your teeth clean, your hygienist is cleaning your teeth, they're usually talking about brushing your teeth, right? So why not spend a couple of minutes? You're in the chair for a while. Why not talk about nutrition, just some key points, because that is truly affecting your gums as well. Just as important as brushing, I would say.
Yeah, absolutely. Actually, I went to the hygienist yesterday, and have you had the thing? It was a really good experience. So shout out to Maureen. She's unlikely to listen, but her and her assistant did a fantastic job. And I don't know if you've seen this before, but she swabbed my teeth with like I can't remember the exact name of the liquid or the fluid, and basically flushed it out a little bit. And then she basically could show me that where the plaque buildup was. So obviously I thought I did a quite a good job flossing and stuff. And she showed me like there's some quite big areas where I'd kind of missed, and from the outside it looks fine.
Yeah.
But once you put this material on, I was like, wow, that's I need to floss better.
And did it show up as a color? So it was like this horrible.
Yes. Yeah, it showed up as bright purple.
Oh no, that even makes it worse.
She basically said, "Oh, so I'm going to put this thing in. You're going to wash it out. Your mouth might look a bit pink." And then I was like, "That's a flat out lie." Like I lifted back my lips, and it was pure purple. I was like, "Maureen, I think you've sailed down the river here." But no, it was really interesting to see that, despite me thinking that I was doing quite a good job from sort of my teeth cleaning perspective, it's easy to miss areas, and there's certain bits, and I'm like, I guess I'm because I'm in dentistry, I appreciate that I need to clean my teeth and that, but not everyone has that outlook, and not everyone maybe has access to the oral dental care. So I can imagine there's a lot of people that suffer from from this.
Right.
So we've kind of talked about the benefits of finding out the problem. We can talk about how individuals can kind of rectify that. But I want to just quickly dig into like the technology. Like how do you even measure these results, and how do you even pick up this thing?
Okay, so the technology that's housed in the scanner, it's called resonant Raman spectroscopy. That's a mouthful. And it was invented.
That is a mouthful.
It was invented in 1930 by Sir C.V. Raman. And so it's been used in science labs, like even to this day. It's used as measuring, and it's also called light refraction. And he was very interested in why icebergs look blue. So that's what prompted his research. And so we basically we patented it, and we have about 18 patents, and we have the rights to the technology. And this is something you'll be really excited about. I didn't tell you ahead of time, but I know how much you like astronomy. so
just a little bit.
Yeah, I know. So this technology has a history in astronomy, used with telescopes. And
fantastic.
So
it was so was it originally designed for astronomy?
That was just one of the using science.
One of the applications.
One of the applications, and then also the National Institutes for Health gave research funding because they wanted to find a way to assess disease risk of the eyes, because there's like 240 eye diseases. So the technology, the first scanner used to measure the eyeball with a laser to measure zeaxanthin and lutein serum in the eye, so because that protects the macula. And concentrations, I mean. And so first of all, it was designed for that, but then they realized after further research, they could get the same score through the tissue in the hand. So then it became like, oh, all doctors could utilize this. And the first scanner came out in 2000. And now we have like the third iteration. It's very tiny, works with Bluetooth. I have an app on my iPhone, or you could use an iPad. Like, it's pretty high tech, pretty slick.
It's high tech, but like accessible.
Yes. Oh, totally. Yeah. Especially now. I mean, it's so easy to use, and it's mobile. Yeah. You can move it around the office if you have different rooms with chairs, that kind of thing.
Perfect. No, that sounds awesome. No, that sounds really good. So you've explained where the technology came from, and you've kind of touched on the size of it. It's kind of like a Kleenex box. Mm-hmm. If I'm a dentist listening, like how would it fit into maybe my workflow? Like how would I possibly use it with a patient?
Okay, so what would happen is, I first of all wanted to say too, is we have barely scratched the surface with dental practices. So basically, and green dental practices are an obvious fit, but any dentist could be preventative. It's very quick and easy. Let me just see. So even though, I know they have a fast-paced office, so perhaps at the front desk, they could be introduced to it there. And then also when the dental hygienist is cleaning their teeth, we talked about this before, but she can talk about, or she or he can talk about nutrition. And then you can say, well, would you like a scan before Dr. Jones comes in? So then she can give the scan a report to the doctor, and they can look at it, and then we will have decided what types of supplements they want to offer their patients in order to improve. And then they can decide what they would like to try for 2 months, and then they come back in 2 months to retest, and that also makes them the bond stronger to the office.
Yeah, it's because it's a really interesting concept, because I have spoken to a few dentists recently, and they are very much like, yes, we're dentists, but like, how can we help the whole body?
Right.
Like, it's not so I think that would, are you in the UK yet? Are you?
We are. It's a different program over there, but yes, it's definitely in the UK as well. Yeah.
Because I might have someone. I know someone that would like to know maybe a bit more about that. So we'll follow up that after.
Okay.
But no, so we've got this kind of, the patients come in, and at some point whilst they're in the practice, there's if there's an opportunity to kind of take a scan, and that can flow in. Now, how do most practices approach the scan? Do they charge for the scan, or do they sort of include it? How does that work?
Well, we have doctors that do both. We have some that say, hey, I just want to scan every patient. So then they don't charge for the scan. But typically we tell them $20, and it's not covered by insurance. It's not a lot of money out of pocket. People usually do not have a problem spending $20. And especially if you educate and explain why it's important. And yes, the doctor would like to see where your antioxidant levels are, so that we know, if you're more open to disease or not. So it could be any disease, right? At this point, but I mean, also we're primarily protecting against periodontal disease.
Perfect. So there's maybe sort of charge like, and $20 isn't a lot. Like, it's quite a nominal amount, especially just to find out how healthy you are.
Right.
And that kind of just covers the cost of the scanner, or?
Yeah, right. And then also you get commission from the supplements, and the patient buys directly off a website, so then they don't have to house the products. You don't have to have expired supplements in your office. So you have a solution that can help the patient. Yeah.
Fantastic. So you're basically, from a dental practice perspective, you're able to offer an extra service, to health-related service that can benefit the patient's immediate sort of dental health or oral health, but can improve their overall health as well. So that's obviously great from a trust perspective, or just great for, like you say, building that bond. Yeah. Because if my dentist was looking out for me and was like, we'll check this as well, then that would, I don't know, I'd feel more confident. I'd feel more comfortable. There's a good chance that I'd stay with that dentist as well. So that's a great to sort of induce or instill loyalty.
Right.
And then on the back of that, the dental practices can actually earn like a fee or some commission based on, the supplements that would then, improve the health of the patient as well. So, and there's no logistics or fulfillment required.
No, absolutely not. And by that, what do you mean by fulfilling? You mean?
Oh, perfect. Oh, yeah. Sorry. So the patient buys it directly from you guys.
Yes, right.
There's no need for the actual practice to handle inventory or anything like that. So so it's kind of like it's hands off. Yeah. Yes. Perfect.
Yeah, and so when the patient goes to pay after going to their dentist appointment, then they can settle up and put the order in for the supplements. But then they have the account with the supplement company, so it's nothing to do with the office after that.
Fantastic. So a question for you based on that is, how do the clients that you work with, the dental practices that you work with, how are they kind of marketing this service? Is it just kind of like, as like we just sort of mention it, or are they actually actively marketing it to patients and new and existing?
Yeah, they can definitely. I would do something at the beginning that, this is a new service that we have. Perhaps have the scans for half price for the first month, something like that. And I mean, you could market. It depends on how that dentist markets their services. Anyway, you could a lot of them put it on their website, and many doctors don't put it on their website. It's just whatever they want. We have the material they need to do that. But I just wanted to also mention something, because when we were talking about how it works in an office, do I have a couple of minutes to just talk about this one dentist in Florida? Would that be okay?
I would love to hear a real world example.
Okay,
right.
because I'm not going to go over. I'll put. You can have this in the show notes later. But it's
Yeah.
a dentist that's in Florida. She's retired now, but what she decided to do was do her own study in house of 40 patients, and she followed them over a 90-day period. So she started patients. She was looking at patients with slight to moderate periodontal disease, and they had a zero tolerance for periodontal disease. So what she did was she scanned them to get a baseline reading of their antioxidant levels. She put them on nutritional supplements and had them change nothing else, and scanned them 3 times, the first month, second month, and third month. And I think she measured about 168 sites in the 40 patients, and there was an 80% improvement.
Wow.
So that's pretty significant.
That is a big deal. Yeah, that's awesome.
Yeah. So a lot of doctors call it a behavior modification tool because, people see it, they see the result,
Yeah, because that's the thing. Like, it's all very well someone saying change your diet, but if there's no factual evidence, or there's nothing kind of keeping them accountable, then it's very easy just to go back to your normal routine and eating the crap that you've been eating before. But if you can put a number on it and say, well, that's a bad number, especially if it's as easy as saying take these supplements. Like, it's not like you don't even have to change, like, you necessarily have to change your diet. You don't have to necessarily change your exercise habits.
I mean, obviously it is good to change diet, but it's difficult for people to make that. So, everybody can Google antioxidants. How do you get more, everything's out there, right? So hopefully
definitely.
It'll prompt you to do both.
Yeah, obviously you would you'd improve your physical fitness. You'd improve your nutritional input, obviously, and then obviously the supplements. But I guess doing one out of 3 is better than doing none out of 3.
That's true. Yeah, because most people, I mean, we're all busy, right? People just get into their habits.
Yeah, perfect. No, that's fantastic. Now, is there anything else that you think listeners need to know? Because I think I've learned a lot, and I thought I knew enough, but I obviously haven't. But is there anything else that a listener would need to know about the system, or how it works from a business perspective? Like,
it's the only validated non-invasive antioxidant tool. There's proven patient outcomes, proven revenue model. As we said, it's a value add. It can help create new clients, because if a patient's happy, they tell their neighbor, they come in, you never know, it could create new patient base. And as we said, improves the bond to the office. And I can give a 3-year projection. I basically ask them how many patients they see a day, and we have a spreadsheet that can show them so they can see.
Perfect. No, that's good. Seeing the numbers, maybe the numbers roll in would be quite helpful. But I think what's great is that it's a service that can add value to the practice, but also it will directly benefit the patients.
Exactly.
So it's kind of like it's a win-win for everyone, isn't it? Really, it's not it's not just a money-making scheme. It's a great thing to do. No, that's fantastic. So, based on your conversations with dentists and dental practice owners and stuff, what would be your number one piece of advice for any associate dentists that are thinking about buying or starting a dental practice? Now, it could be related to what you specifically do, or just something you picked up on the way.
Well, what I would say is, obviously, dental practice, there's a lot of expense in that, with the equipment, employees, lease, all that stuff. And whether you buy and it comes with the patients, or whether you're creating it from scratch, I think the important thing is to get that patient base, because even if the clinic does come with the patients, you might want to change the culture. You might want to attract a different type of client. So I would suggest hiring someone that can actually help you with that, to get the patient base that you want. And then also another thing, hire someone like you, Patient Boost. I'm joking. Mike didn't tell me to say that.
It's like I paid you to say that.
I know, I'm only joking. And another thing that I've just been learning along the way myself, which is really important for any business, I think you want to have a vision, a mission, and you want to create culture. What culture do you want? What's important to you? Because that's going to go through to who you're going to hire as a partner. And then that will filter through to the type of patient that you attract. I think that's important at the beginning.
Absolutely. No, I think you've hit the nail on the head there. I think we're experiencing it with a few clients at the moment, where they haven't quite got the right culture in the practice, and it kind of becomes very toxic. And so everyone needs to be on the same page. You need to bring the right people together. But no, that's some very good tips, Deb. Thank you for that. And I'll chuck you that $5 later.
Right, okay, sounds good.
Right. No, this has been fantastic, Deb. It's great to hear of things that a practice can add. Like I said, add to their service list. It's not from their side, it's not a major expense, but adds a lot of value to the patient, and can add a lot, add extra revenue to the practice as well, which is great for the whole team.
Right.
So if listeners are interested in contacting you, learning more, maybe putting some numbers into your spreadsheet, how can they get in touch with you?
Well, my email, I think you can probably put in the show notes, but it's deb@iforwellness.com. I have a website, iforwellness.com as well. And or LinkedIn, whatever.
Perfect. Brilliant. Whenever you find Deb, she's happy to talk to you.
Okay. Thanks.
Excellent.
Thanks.
Right, Deb, thank you so much for your time again. Really appreciate this. And I will let you know when the podcast goes out. So thanks, mate.
Great. Thank you
Thank
so
you.
much.